The news, the World Health Organization says artificial sweetener aspartame is possibly carcinogenic, but according to the WHO, low levels are still safe to consume. Aspartame is used in fizzy drinks and even chewing gum. Now, according to the study's findings, it's unsure how much of the sweetener a person would need to consume to be at risk. We can now bring in France 24's Julia Seeger with more. Julia, great to see you. Talk us through what exactly is aspartame.
Well, aspartame is a synthetic sweetener that replaces sugar and its calories, and it's 200 times sweeter than sugar is. And it was discovered in the 1960s, and it's now widely used by the food industry. So indeed, it is used in diet soda, but it's also used in yogurts, gum, as you said, breakfast cereal, toothpaste, but also cough drops and chewable vitamins, for instance. So it's really widespread, and it's been subject to controversy for decades now. It's back in the spotlight because you have experts from the International Agency for Research on Cancer, which is part of the WHO. They met in June to look at about 1,300 studies on this issue, and they concluded indeed that the sweetener is possibly carcinogenic. So what does that mean? This is scientific jargon for sure, but there are different categories that are used to classify agents. Group 1, carcinogenic to humans, so no questions asked, it definitely causes cancer. Group 2, you have two subcategories, probably and possibly, but in both cases, you have limited evidence of carcinogenicity in humans, but you have evidence in animals. Now, I said limited evidence, so you do have evidence in Group A. Actually, in Group A, you'll find night shifts at work and red meat, whereas in Group B, and this is where they classified aspartame, you'll also find lead, but also other products like aloe, for instance. And then Group 3, and there's also a Group 4, then you have very few evidence that it is indeed carcinogenic. So what does it actually tell us? It doesn't tell us much, because what it says pretty much after all of this scientific jargon is that we still need studies to know more and to really be able to create a relationship between the fact that if there's a high intake of aspartame, it will be carcinogenic.
So do we have to be careful?
We do need to be careful because, as you know, we still have to reduce our intake of sugar and, of course, synthetic sugars as well. As I said, it's been in the spotlight for several decades now, so it means that there's still a lot of suspicions on this. In 2022, there was a huge study in France that was conducted with 100,000 people, and they did indeed conclude to the fact that there was an increased risk of cancer by using aspartame. And they really did a good job with the statistical models to adjust it with age, sex, physical activity, smoker status, BMI, everything, because that's why it's so complicated, because there are so many factors to take into considerations of everything that we take in on a daily basis.
So even though the WHO came out with this recommendation, they're not telling people to change anything?
No, they're not at all. And actually, let's talk about the acceptable daily intake. They didn't change that at all. And it's a staggering number. What they say is that a person should not take more than 40 milligrams of aspartame per kilo of body weight. What that means is if you're a man weighing 70 kilos would not have to take more than 14 cans of soda per day. That's huge, right? So if we were to change the category, that level would actually change as well. And it's important is that this level actually assumes that there's no aspartame elsewhere in what you're drinking and eating, which is not true.
Julia, thank you very much for that.
Thank you.
Julia Seeger there.